Your eyes and your vision are under attack. Damaging blue light from the sun, your phone, your computer, your tablet, even light bulbs and car headlights is constantly bombarding you. The good news is our eyes actually already have a line of defense to counter the effects of blue light. This defense is made up of 3 pigments called carotenoids. MacuHealth with Micromicelle, the only supplement with the exclusive patent on all 3 macular carotenoids and Micromicelle technology.
Do your patients know what presbyopia is?
There are people who are afraid of the press.
Have you talked to your patients about multifocal contact lenses?
I've heard the bifocal, but not multifocal.
Exactly, not multifocal.
Do you need help with your multifocal strategy? Learn more at the conclusion of this episode. With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MiSight One Day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you. Good morning. I'm Dr. Kerry Gelb, and welcome to Open Your Eyes Radio. Please listen as I discuss the newest information in the world of health, nutrition, and sports every Saturday morning, 9 a.m. Central Time on AM 1280 The Patriot. Also, please share your thoughts by emailing me at drkerrygelb@gmail.com. That's drkerrygelb@gmail.com. According to Dr. Halstead Holman, chronic disease is now the principal cause of disability and consumes approximately 78% of the U.S. healthcare expenditures. Today's guest, Dr. Mandy LaGreca, is a doctor of clinical nutrition. Mandy's passion to help others stems from her eating disorder she experienced in high school and college. Mandy later developed IC, or bladder pain syndrome. Unable to get relief from conventional treatments, she turned to integrative approach to finally get help. Dr. Mandy now helps others who suffer with interstitial cystitis, IC, or bladder pain syndrome. Please visit her website, ichealer.com, where you can learn about her programs. And if you have interstitial cystitis and you would like to make an appointment, you could do it through her website. Dr. Mandy, thank you for joining me today.
Thank you for having me.
You know, since you're a doctor of clinical nutrition, before we get into IC or interstitial cystitis or bladder pain syndrome, which affects more females than males, and about 10 million people in the U.S. have it, but a lot of people don't know much about it. I just want to talk about some clinical nutrition in general, since you're a doctor of clinical nutrition. So for people that are watching out there, and I know you like to match the best diet for each person, but say someone is generally healthy and they just want to eat healthier, what do you think is the best way of eating for the general public?
Oh, yeah, that's really easy. Eat as close to nature as you possibly can. Really, bottom line. I think we've really moved away from natural eating. I mean, look around us, you go to a grocery store, it's really hard to actually eat naturally because 90% of the grocery store is processed. So if you're listening and you don't have anything that's really a chronic condition or something, similar to IC or anything else, autoimmune condition, and you want to clean up your diet, follow the 80-20 rule. I always say 80% of what you put in your mouth should be something that you would have killed or grown yourself. And that's something to really think about. Totally unaltered and natural as you possibly can, whether that's lean protein or fruits and vegetables or whole grains. That's really the bottom line. The second thing is, don't eat as much as we think we need to eat. We as our ancestors have been equipped evolutionarily for fasting. We have an evolutionary mechanism, and we're meant to do so. And I think our modern society has forgotten that because of availability of food, and everything revolves around food, right? Like every social event, even like going to like a kid's game, they're giving out ice cream. I mean, it just seems like this is just the norm, but we really have to start to get back down to what our ancestors did. And we had periods of eating and we had periods of fasting. And I believe that that's, the 2 main things that we can do. The third thing is start moving more, exercise. I know it's hard because we live in front of a computer and television and our cell phone, right? It's something that we've moved away from. So we have to intentionally exercise and get time outside in the sunlight with the UV light, because that's the natural source of vitamin D. Spending time on walking outside in the air, getting the oxygen and grounding. And I think if you can do those three things, you can find yourself in a much better place with health.
So if we eat non-processed food and we want to eat meat that's grass-fed or organic chicken, as a doctor of clinical nutrition, are you okay with it, or should we just be vegetarians?
No, I think we're omnivores. One thing you're going to find if you start to look at my content on YouTube and the things that interviews that I bring along is I am not an extreme dieter. I don't believe in any of those extreme diets. I think they're temporary. I think they're short term, and they may have a therapeutic purpose in the short term for most people. Now, there are exceptions, like, for example, dementia, Alzheimer's, they do better on a ketogenic diet, but that's a whole different topic. General wellness should be, we are omnivores. We're meant to have meat. We're meant to have plant-based food. So I'm not going to promote veganism. I'm not going to promote the carnivore diet. I'm just not.
And you mentioned fasting before. Are you a proponent of fasting? And if you are going to fast, what do you think the best way to do it is?
Well, I just broke a 3.5-day fast today. So I am a big proponent of fasting. I just fasted for 82 hours. Knowing my, so if you listen to my history, I had an autoimmune-like condition. So IC has a lot of symptoms similar to an autoimmune condition. And that was one of the main ways I was able to put my bladder pain into remission, was with a 5-day water fast. And I do one every quarter. So every quarter I'll do like a 3 to 4 day fast. I think it's very individual. So for most people, start with 12 hours. I think everyone should be, there should be a 12-hour fasting window for every single person, not excluding children. Okay, so children are not, so let's exclude children out of that. But for adults, from the time you eat dinner till the next morning, there should be a minimum of 12 hours. Now, the older we get, the longer that window should go, just because there's more, things going on with age, oxidative stress, inflammation, that fasting can clean it up. So, when I'm talking to somebody who's trying to lose weight and they're overweight, 16 hours a day is ideal. So if you can get a 16-hour daily so that would be eating dinner at 6 and breaking it at 10. That's not very hard, right? 6 o'clock to 10 a.m. And then there's periods of time where you want to go a little longer. And so for people who want a little bit more, maybe they want more advanced weight loss, or maybe they want to clean up some inflammation, or maybe they have some rheumatoid arthritis, or they have some aches and pains, then it's ideal to do maybe a once a week, maybe do something like 18 to 24 hours. And then when you're getting really hardcore like me, then you're looking at like a 3 to 4 day fast a few times a year. And that's not easy to do, and it's not for everybody. So just want to make that clear.
So for people that do want to fast 12 hours or 16 hours, there's some people that say skip breakfast and eat the last meal, just eat dinner. And then people go to sleep. And to me, that's the sumo wrestler diet. You just eat and then go to bed. So to me, it makes more sense. If you're going to skip a meal, it should be dinner, not breakfast. But I want to ask the expert. I'm an eye doctor, not a doctor of clinical nutrition. So what do you think about that?
It's all variable to the person. Generally with women, stress hormones can also be affected when there's too much hunger because of blood sugar imbalances. So some of that is going to depend on your blood sugar situation. Many of my patients that come to me have hypoglycemia. They have, their blood sugar cycles are broken. Okay. So what I'm trying to say is, for those of you not sure what I'm talking about, when you eat carbohydrates, it has to break down in a manner that it can actually be utilized for your cell to do its processes to make, and you may have learned about this in high school, ATP. This is the energy currency of the cell. Ultimately, the point of eating is to produce that so we can have energy to do our functioning of your cells, your organs, they have to function, they need energy. Many people, for various reasons, it could be environmentally, environmental toxins. It could be poor, nutrition, like micronutrient status might be weak. So you might be low in certain nutrients. They don't do that very well. And so when they do fast, one of those blood sugar processes, which involves the conversion of non-glucose sources to glucose. So meaning when you fast, your body starts to dip into stored glucose for energy. That's known as gluconeogenesis, but that's what I'm trying to say what it is. they don't do it very well because of these reasons I mentioned. And so they feel really bad when they're fasting. They get lightheaded, they get hangry, they have brain fog. You got to train your body to be good at this. And the only way to train it is to fast. By fasting, you're training your body to be better at breaking down non-stored sources of glucose for energy. So that's why women generally have a harder time because of hormones. There's some hormone things going on with estrogen that when they fast, they have more of those side effects. Men seem to do it much better. So anytime I fasted with a group of people, men and women, the men seem to roll right through it without any problems. The women tend to have more of that, fatigue and things like that. So
And
so
you
it's
talk,
variable. So to answer your question, it depends on who you are. If you're a person who's more hypoglycemic, I would say eat your dinner and skip your breakfast. But if you have more of a better management of your blood glucose, then you can probably go ahead and skip dinner and go through that way.
yeah, I mean, blood glucose is a major problem, high insulin. Many people start off with high insulin before their blood sugar goes up, and the side effects to insulin and sugar are very similar. For the regular person who's pretty healthy, they really don't have any problems. What kind of supplements would you recommend, or would you recommend any basic supplements people should take?
Absolutely. We are in the 21st century, and the toxicity level, environmental toxins is rampant. I think the best thing you can do for yourself is get a good quality binder. To bind up those environmental toxins and safely remove them from the body. Just because I think what people don't realize is when disease happens, it didn't happen yesterday. It was from the accumulation of the last 20 years. This is what I tell people who come to me and they're like, oh my God, I just woke up with bladder pain. No, you didn't. You just probably had it brewing and then something broke the straw that broke the camel's back. It could be, for a lot of people lately, it's been, viruses, right? So that's what I would think is the number one thing is to have a good quality binder. And the one I really like is zeolite. So I'm a big proponent of zeolite. It just has such a widespread ability to bind so many different toxins, from mold to endotoxins, from bacteria, from heavy metals, glyphosate, all of that is a very superior binder. I give it to my children. I'm actually have one right here. It's my zeolite shake. So I will do zeolite in a shake. I'll throw it for my kids. And that's a really simple thing to do. The one I use is a product called ZeoCharge, and it's a powder and it doesn't have a flavor. You just mix it, and that's number one. The other thing that I would recommend is, a multivitamin. If you haven't done a vitamin test and you don't really know if there's any, deficiencies or per se, a good quality multivitamin, whole food would be fine, whole food vitamin, because our soil quality, and multi-mineral as well, vitamin and mineral, because our soil quality is just not where it should be. I mean, for example, there's barely any boron in our soil, right? So there's a lot of different micronutrients that are missing. And so if you could replace that with a quality multivitamin, multi-mineral, that's important.
Give me a brand of a multivitamin, multi-mineral that you like.
So there's a bunch of Pure Encapsulations has a good multivitamin. So I like the cleaner product lines. If you don't have access to those on Amazon, there's a few out there that are, just make sure, I don't know specifically a good brand on Amazon, honestly, because I shop through my dispensary. So Pure Encapsulations is a good one. Thorne has some good ones. As long as it's got, at least the RDA of what your vitamin and mineral needs are. And, mineral wise, you can do like trace element drops in water, and because that's another thing. I think when people filter their water, they don't realize that they're also filtering the minerals. So they need reverse osmosis water. It's removes almost everything, right? So you're actually removing the minerals. So you're going to want to replace that. And so there are you can get some drops online and replace it in your water. So, and honestly, sea salt, like Baja Gold sea salt is one brand that I really like. It has a lot of minerals in it besides just salt. So if you're going to use salt in your food, a sea salt, that's a good one, Baja Gold, because it has a wide range of different minerals in it.
So you mentioned zeolite. Do you have to take it away from vitamins? You have to take it away from food so it doesn't bind out some of the good things that you're trying to do for yourself?
The research shows not necessarily. It actually shows that it helps absorption of minerals, interestingly enough. It's not like charcoal. Activate charcoal will do that. So with activate charcoal, another binder, you would want to take that away from food and from supplements. But my understanding with what I've learned about zeolite is it actually enhances absorption. So it's a very interesting dynamic. So what's binding the toxins and the metals, it's actually helping you absorb your minerals. And that's why when I take my zeolite, I also take it with fulvic acid together, because fulvic acid is another really good mineral supplement. So if you want to get good quality minerals, you can get it through a fulvic acid and take them together. So the company that I use, the Zeo Charge, they have a fulvic charge. So I tell my patients, take your Zeo Charge with your fulvic charge. And I'll tell you, people who've done it, they've noticed a dramatic rise in their energy levels.
And to take the folic acid with it is, or methylfolate, is it folic acid or methylfolate?
Oh, fulvic acid. It's not, yeah, it's not the same thing as folate. It's this is more a mineral product.
And you have the zeolite shake. What do you put in it? I saw you drinking it. What do you put in that?
This one particularly has flax milk and half of a banana and 3 tablespoons of Zeo Charge and Manuka honey, and it's really good.
And Manuka honey, you know, is it too much sugar? Is it healthy? What's good about Manuka honey compared to regular honey?
I like its antimicrobial properties. I like how it's a prebiotic for the GI tract, the good microbes. It helps, you know, if you have like a strep in your, well, now understand, like a lot of times when you take something orally, it doesn't always make it to the digestive system. But if you have like, you know, strep in the mouth, it helps compete with it. And it tastes really good. It's anti-inflammatory. So, you know, there's other honeys. You can also do raw honey. I mean, I'm not like particularly like, you have to do Manuka honey. No, I mean, you could do other types of honey, but honey has a lot of therapeutic properties. If you just Google the therapeutic properties of honey, people don't realize, like, if you get a good quality honey, it has a lot of benefits for human health.
I had a friend who had shoulder surgery and he had a wound that wouldn't heal for months. And they tried all different antibiotics. And then finally he put Manuka honey on it and he made a paste out of probiotics and put it on the wound, and it was better in a day. And I saw it with my own eyes. I'm not telling people at home to do it, but I saw it with my own eyes.
No.
It got better.
I can give you a remedy. I actually did it with my fiance. He had an affection on his skin that would not heal either, probably some type of, you know, maybe it was MRSA. We never actually went to the doctor for it. And so we took some activated charcoal and we made a little paste and we placed it on the wound, and it helps pull the toxins out. And then we alternated that with Manuka honey, and we did that back and forth 4 times. We did the charcoal and then the Manuka charcoal, and it completely cured it.
Unbelievable, right? It's just crazy. So when we look at chronic disease, the incidence of chronic disease is skyrocketed. As I said in the opening, you know, almost 80% of our health expenditures are spent on chronic disease. What do you think is causing the chronic disease epidemic that we have today? Is it just genetics? Is it environmental toxicity? Is it poor food quality? Are we just getting older? Stress? What do you think?
I think it's a combination of not spending enough time with nature and stress. I think we have our families are fragmented. We don't spend enough time, you know, with our family members. We're everything's go, 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 go. I mean, I live in North Carolina, so not so much here, but I'm originally from New Jersey, the New Jersey, New York area. It's horrible there. I mean, that's why we left, because the stress levels are ridiculous. Just sitting in traffic for 45 minutes every day is stressful. So I think it's a combination of financial stress, family stress, maybe marital stress, you know, work. And then there's, you know, pollution, right? Like think about like New York City and air pollution, and then our environmental toxins. And I honestly think the other piece of it is the food industry. I think they're poisoning us. I think it's just what they're putting in front of us is not good quality. And we're seeing a lot of people who've got a ton of inflammation in the body. Oh, and one more thing, our GI tract is not healthy. We have a very poor GI tract profile in the westernized countries. Leaky gut, you know, I'm sure you heard that term before, dysbiosis, antibiotic overuse. Like when I was a kid, I was drinking that stupid pink penicillin, you know, remember that bubble gum flavor. They make it seem like it was like the best thing ever. And here I am later, you know, 20 years later, and I'm stuck with this disease. I wonder if it was all from all those antibiotics, you know? So, and then C-sections too. We have a lot of C-sections. Babies are not being born vaginally as much anymore. They're not being breastfed, a lot of things.
Were you on the bubblegum medicine
I was on the bubblegum.
for a year or so to prevent ear infection, or is that why
Oh.
you took it?
Oh yeah, on and off. I was constantly on that bubblegum medicine. I ended up having tubes. I had my tonsils removed. I had all of that, and I wasn't breastfed. I was not a breastfed child. My mom said she couldn't produce milk, and they pushed formula on her in the hospital anyway, because they were saying back then it was better for you than breast milk.
Right, right. And before we were talking about supplements, I think I cut you off. Are there any other like omega-3s or any
Oh
other
yes, thank you.
types that vitamin D3, K2 that you would recommend? Of course, as an eye doctor, we recommend lutein, zeaxanthin, mesozeaxanthin to protect the macula. And when we start getting into bladder pain syndrome, we'll talk about some of the drugs that could cause a maculopathy. But how about some of those other supplements that I just mentioned?
Oh yeah, people do not eat enough fatty fish. So I have found when I run testing that their omega-3 acids are too low and their omega-6s are too high. And so, doing a fish oil is great because you get the EPA, DHA. However, you still need to get the alpha linolenic acid, the precursor to the EPA, DHA. You have to get the fish oil from the fish. And if you don't like fish, then you got to find an alternative source in your omega-3, and that's walnut oil, and that's also flaxseed oil. Flaxseed oil is really good because it has omega-3, 6, and 9. So people have to start incorporating better fats in their diet. Honestly, I think that what I'm seeing is a lot of people are getting their fats from meats, high-fat meats, like pork and high-fat quality beef. And also, if you choose to eat or grass-fed beef, you're going to get a better profile of omega-3 to omega-6 because grass-fed has a better fatty acid profile. So switch away from your grain-fed beef and switch to grass-fed. And if you need to include a supplement, then fish oil is fine. I want to mention this caveat, though. I have seen a lot of times where people have omega-3 dominance. And so you don't want to, I always say, test, don't guess. If you want to do it right, run the test so you know what you need.
What is omega-3 dominance? I never heard that before.
It's when you have too much 3 and not enough 6, and then you end up having other issues with histamine. So
Okay.
you don't want to have too much 3. Everything has to be balanced. Again, I said earlier, I believe in balance with a diet. I believe in balance. Well, even when it comes to supplementation, there has to be balance. I'm going to give you a great example. People are taking too much zinc. I think because of this whole, epidemic going on with viruses, people are taking too much zinc and they're actually depleting their copper. And when you deplete your copper, because copper and zinc are a seesaw, they have to be balanced. You have low copper. Now you can have all the problems associated with copper deficiency. And one of the big ones is histamine intolerance, which is allergies.
We're talking with Dr. Mandy. She's giving us great information. When we get back from the break, we're going to talk about IC and bladder pain syndrome. We'll be right back.
MacuHealth, your science-born and tested solutions for visual performance, macular degeneration, and dry eye syndrome. New products coming soon. Embrace the science.
I'm back with Dr. Mandy LaGreca of ichealer.com. She's giving us great information on nutrition and health. She's a doctor of clinical nutrition. And before she talked about zeolite, and it's called ZeoCharge, ZeoCharge from Zeolite Labs. And I think Mandy has a coupon for that. So if you go to her website, you could get that. And at the end of the program, she'll explain how to get all those things. But as we come back from the break, I want to ask you, Mandy, about colors, different color foods. I noticed that a lot of people, I would say, if I did a survey, I would say probably close to 99% of the people eat the same foods over and over again. They have like 5 foods they eat and they just eat them over and over again. How can we do better with that?
Oh yeah, this is so my wheelhouse. Oh my gosh. So one of the number one things people tell me is, what can I eat? And so I show them the rainbow diet. So this rainbow diet was actually developed by Deanna Manich, who's also CNS, and she explains the benefits of eating plentiful colors in your diet. And that's really good for not only your immune system, but also for your microbiome, the little microbes in your gut that are sending signals throughout your body. It helps them become happy, makes them happy. So one of the ways to do that is, well, first of all, go to the grocery store and spend more time in the produce aisle. Walk away from the middle aisles and spend most of your time. If you see me in the grocery store, I am mostly in the produce aisle. I wish it was bigger. And try to get one color of the rainbow. So I think there's 7 colors. Yeah, 7 colors of the rainbow. Get one of each from fruits and vegetables. And when you make food, you're going to try to get one of each color at each meal. So if you're making a shake, you might want to put a little bit of each thing in your shake. If you're making a salad, that's pretty easy. You can put apples, strawberries, blueberries. You can put, red peppers, green peppers. I mean, it's not a hard thing to do. It's just something that you have to get accustomed to doing. And I think because we're creatures of habit, you're right. People go to their beef and broccoli and their potato, and that's their dinner. We need to really start to think about how to improve the microbiome. I want everyone listening to watch a movie called Let Them Eat Dirt. It's a really good movie about the microbiome. It's on Vimeo. I always show it to my students because I'm also a biology instructor as well, and they love it. Show it to your kids. Teach them about the importance of your microbiome and how your diet is the one and only tool we have to improve our microbiome. We don't have a lot of tools. We're not going to run and do a fecal transplant. It's not necessarily recommended to do that. The one tool we have to improve our microbiome is through diversifying our diet with the colors of the rainbow, plain and simple.
And do you recommend probiotics, prebiotics, since we're talking about improving the microbiome?
I do. I don't think most of the probiotics in the market are actually doing much. The ones I really like are the soil-based probiotics, the Bacillus subtilis, and I use a product through Microbiome Labs called HU58 and then Megaspore. The research has shown that these probiotics are actually modulating the environment of the GI tract and improving like the acidity of it and the environment to allow your diet to do its job better. So I think it has to be a combination of the probiotic, and they have a prebiotic product as well. Together with your diet, they kind of work synergistically. So you can't just take a probiotic and eat junk food. And I don't think you can just eat healthy and not take one nowadays because of this 21st century. I think we've killed a lot of our really good microbes through our, lifestyle, through antibiotics, through pesticides, herbicides. So I think we still need some of these probiotics to help give us a boost.
And how about fermented foods?
It depends on the person. So I work with a lot of people with bladder pain syndrome. They can't take fermented foods because it causes histamine. They are high in histamine. So if you don't know what histamine is, think about if you have an allergy and you go outside and you start sneezing, or you have like runny nose or itchy eyes, or if you get a skin allergy, that's histamine. Well, people with bladder pain syndrome have a lot more histamine in their bladder. And so when they eat fermented foods, they will have more bladder pain because they're having more histamine being produced in the bladder. So they can't. And I recognize this with myself because I was drinking kombucha all the time. And every time I drank it, I had pain and I didn't understand why. And now looking back, that's what it was.
Well, since you brought up bladder pain syndrome, interstitial cystitis, bladder pain syndrome, you're an expert on that. What is bladder pain syndrome or interstitial cystitis?
Currently, the medical literature calls it idiopathic. It is considered non-infective, and there's 2 different types. There's the ulcerative type and the non-ulcerative type. So most of my patients have the non-ulcerative type. People who have the ulcerative type have Henner's lesions, and they're given a different diagnosis. Treatment's different. It's kind of like IBS. Like IBS, people are like, what is it? It's a cluster of symptoms, but they can't really pinpoint an exact cause. They haven't been able to say it's caused by this bacteria or it's caused by this virus. Like the Hunters, there was more of a cause, but everybody else, BPS, bladder pain syndrome, people like me, we didn't have a real direct cause. So it's kind of idiopathic, but it's a cluster of symptoms. So what are those symptoms? Burning when you urinate, burning in the bladder, like it's on fire, pressure, urgency, like you have to run to the bathroom where you're gonna, go in your pants, urinary retention, pelvic pain, painful intercourse, painful urination, and getting up at night a lot to urinate. So that's the primary symptoms of this. And when someone is going to the doctor and they go in and they say, I have these symptoms, and they do a urine analysis and there's no bacteria generally when they do it, they say, okay, well, it's not a UTI, you probably have IC. So that's kind of how it's being diagnosed. There are other ways to diagnose it, like a cystoscopy and those kind of things, but they're not really finding. A lot of women don't get any answers from these tests. It's usually just symptomatic.
And people could urinate up to 60 times a day.
Absolutely.
I mean, that's a pretty uncomfortable way to live. And there's approximately 3 to 8 million women, and even men get this, 1 to 4 million men. So there are about 10 million plus people that suffer from this condition. And nobody really knows the cause of it, do they?
Well, we are getting really close to it, at least on the integrative side. On the conventional side, not so much. But on the integrative side, we do think that there's a lot of causes, actually. There's obviously, we know there's inflammation in the bladder, but the million-dollar question is why? Well, we are finding that there are some people who have what's called an embedded infection. I hate that term because it doesn't sound scientific, but in reality, it just means that there might be a biofilm and some dysbiosis in the urinary tract, because we know now that the urine is not sterile. We thought it was. We used to think it was, because when we did cultures, that's what was taught to these doctors. But now with some of these new diagnostic tools like PCR and whole genome sequencing, we're realizing that no, there's a microbiome in the bladder, and it should be mostly lactobacilli. But what's happening is, because of all these things we talked about earlier, toxicity, antibiotic overuse, stress, we're having more dysbiosis now in the bladder, and that presence of bacteria, and there's some common ones that are often found, they're inflammatory. And because they're inflammatory, they're causing damage to the bladder lining. But to make complications even worse, there's a whole nother piece of this. There's oxalates in our diet and oxalates in our gut that are actually creating damage to the bladder lining as well. They're really sharp. And I know, because I used to pass oxalates all the time in my urine. I could see it. Like, I literally could see it. And when you did a urinalysis, you could see the oxalates because my oxalate levels were high. So these are crystals that your body produces about, as part of your own metabolism. Everyone makes oxalates, but some people make more. Some people pass more. Maybe their diet's high in oxalates. Maybe they're producing a lot of oxalates. That's the other root cause that I'm finding with this problem.
And the urine is cloudy when you look at it, with someone
Correct.
that's passing a lot of oxalates.
Correct. Correct.
Conventionally, for the treatment of bladder pain syndrome, Elmiron is a drug that's used. And if you could talk a little bit about that, I could tell you from the eye point of view, that drug could actually cause central blindness, because it could affect the part of the eye called the macula, and you can get something called a maculopathy. And people, you don't usually get it until they've been on the drug about 14 years or so, but people can start having symptoms about 3 years. So if they are on this medication, Elmiron, they have to be checked regularly by an eye doctor. Same with Plaquenil. Plaquenil is used with rheumatoid arthritis, and we see that in the eye, that it could be a side effect of someone with lupus or rheumatoid arthritis on Plaquenil. It's something very similar with Elmiron. But have you seen that? Has patients done well, before we get into the integrative approach? How have people done well? And do you see a lot of people with hair loss as a side effect? They get diarrhea or nauseous from the medication.
So understand the people who come to me are people who probably refused conventional treatments or have had bad side effects from them. So they're coming to me as basically like, you're my last hope. I was offered Elmiron and I denied it because I saw the side effects was hair loss, and you see the amount of hair on my head. I did not want to have to do that. So that was
me. You don't want to look like me.
I didn't want to. Yeah, exactly. I didn't want to lose hair. I have a good head of hair. That was a deal breaker. The only thing I know about Elmiron is supposed to help replenish the GAG layer. And that is basically a glycosaminoglycan layer that's over your bladder lining, which protects it from things like bacteria and oxalates and all the other acidity of the urine. And the conventional medicine says that it has been deteriorated because of, they don't know why. So there's a reason why, but medical community doesn't know. So they just put you on this medication and it's supposed to help replenish it. I can tell you that most of the patients who've been on it, it hasn't helped them. So obviously the underlying problem isn't the GIG layer, because if it did, this would have helped. I didn't like the medication because I didn't like the side effects of the hair loss. So that was the number one thing. And then when I found out about the eye thing, I was like, good thing I never took that thing, because I do have one patient who has had macular issues from it. So
now, as far as treatment goes, there's detoxification, saunas, and ozone therapy, which I'm very interested in. So tell us a little bit, as we're coming up to the break, we have about a minute left, just a little bit about detoxification, infrared sauna. Is that helpful?
Again, it depends. Some people who come to me and I run the hair tissue mineral analysis on them, they're so depleted in their minerals that the sauna will actually deplete them more. So I, as a nutritionist, have to replenish them. I have to rebuild them. So for people who are low in nutrients and they're totally tapped out, they should not go in a sauna very much. Everybody else, yes, doing a sauna is helpful, but again, it's not going to cure the problem. It's got to be multiple things going on. But yes, it does help remove some of the toxins. It also helps upregulate mitochondrial production. And anytime you improve energy in the body, your body figures out how to heal itself.
And we've been talking about IC or BPS, interstitial cystitis bladder pain syndrome, which is a little more common than most people realize. And people that have it are very uncomfortable. They're running to the bathroom, up to 50, 60, maybe 70 times a day. They can't sleep. They have no energy. And as we're at the break, Dr. Mandy was talking about how we could help people, a multifactorial approach. How can we help people with IC or bladder pain syndrome? Mandy, could you continue?
Yeah, so the first thing is I as a practitioner have to know your health history. If I don't have your health history, it's very difficult for me to help. So that's the first thing is, if you're gonna have to understand that there's reasons why you're here. It didn't happen overnight. There was probably something that triggered it. I see a lot of things like trauma is a big one. I see birth control use. I see things like mold exposure. I see people who were vegans and they were juicing lots and lots of oxalates in their diet, and I see a lot of gut dysfunction. And so those things have to all be unraveled. And so through, patient interviews and getting to know them and then running labs. I mean, I hate to say it, but you got to test, not guess, right? Because if you look, again, I just told you the example of zinc and copper. If you don't need those nutrients, you shouldn't be taking them, because you could create another imbalance. So it's important to have the right appropriate testing. And then the interventions are going to be tailored around the results of that plus your health history. And so, for example, a very easy way to do this, if you have this condition and you want to come out of it, is, get on our good supplemental protocol that's going to help reverse some of your mitochondrial dysfunction that you might be dealing with, and helping your body detoxify, whether it's mold toxicity or glyphosate or whatever it is. But the big thing is, and I'm seeing across the board, is mitochondrial dysfunction. And so that means that you are not producing energy. And this is happening with even younger people. Mitochondrial dysfunction is generally supposed to happen when you're older. It's pretty much the hallmark of aging is mitochondrial dysfunction and oxidative stress. But I'm seeing more people in their 20s who have the metabolic function of a 50-year-old or a 60-year-old. It's very surprising. And so this is a problem. And so this needs to be reversed. And you can do that with good diet. You can do that with good lifestyle. We talked about sauna. We talked about exercise. We talked about spending time in nature. And then the supplements to help improve your mitochondria to function. Because ultimately, when you have better functioning mitochondria, you're going to feel good. You're going to have good energy. You're going to have less brain fog. And you're going to have less inflammation. So that's really how it works.
So give me some of the supplements that you recommend. Coenzyme Q10, PQQ, is it? What other supplements help mitochondria?
Well, honestly, antioxidants, really. So things like glutathione, but again, not everybody can take glutathione right off the bat because they might react to it because they may not be recycling it. So there might be an NAD issue. So depending on what the labs show, you might take some NAD for a little while and then take some glutathione, especially if your levels are low. There's broccoli sprouts. Wow, the world of broccoli sprouts. We have so foregoed here. It helps upregulate a pathway called NRF2, which is an antioxidant pathway, but also helps control your glutathione. So NRF2 actually controls glutathione. So if your NRF2 is weak, you're going to have weak glutathione. So you need to support your NRF2, which is through broccoli sprouts, which is has something called sulforaphane in it. So that's really great. And if you wanted to eat broccoli sprouts, that you could do that. You can get your sulforaphane. Make sure you sprinkle a little bit of mustard seed on it because it activates the sulforaphane. Supplement-wise, the probiotics I mentioned to you, the spore-based, I give them to my kids. The prebiotics, that's not going to hurt. The Zeocharge and these binders to bind up the toxins. And then I think a lot of people are deficient in magnesium and vitamin B1. I'm seeing that across the board. A lot of thiamine deficiency. Processed foods can deplete your thiamine. Guess what else depletes your thiamine? Alcohol. So if you drink a lot of alcohol, or you did when you were in college, you might be deficient in thiamine, and that might be why you have blood sugar problems. So thiamine, magnesium, again, they seesaw just like zinc and copper. They need each other. So there are nutrient partners. So you got to make sure if you're going to take magnesium, you take B1. Don't take them separately because you might create a deficiency of the other. B6 across the board is very, very problematic with low. Birth control pills can deplete B6. You know what else can? Antidepressants can deplete your B6. There are drug nutrient depletions. So if you're on a medication for something, you might be creating a depletion, like a lot of statins can deplete your CoQ10, for example. So you need to be taking CoQ10 if you're on a statin. So again, it's very individualized, but there are some general things.
Before we talked about ozone therapy. Tell us a little bit about ozone therapy. We got about 5 minutes left. I think people listening to this would be very interested, something they may not have heard about in the past.
So ozone is a gas. It's 3 molecules of oxygen, and it's actually a very reactive molecule. And that's the beauty of it. Because it's so reactive, it has a lot of therapeutic benefits. I first discovered ozone by a colleague of mine because I was struggling with UTIs. I couldn't get through why I keep getting UTIs, and I couldn't actually resolve them with antibiotics. So I started to explore this whole ozone world. And now a lot of integrative practitioners are using it. So it's a gas. You could administer it in your vein through a process called autohemotherapy. You can administer it rectally. You can administer it vaginally. You can actually treat it. With dentists will use it as well. You can drink the water. You can actually, things, you actually put them in your ears if you have ear infections. And so what it does, remember I just said NRF2 pathway, it upregulates it, just like the broccoli sprouts does. And through that, it can actually modulate your immune system. So it's not like curing anything. It's, again, supporting your immune system like nutrition does, and it helps upregulate your mitochondria as a result. And then you end up having a better functioning immune system. So your immune system can take care of the problem. That's what it does.
The NRF2 pathway is very good against oxidative stress.
Yes, it actually has functions as a antioxidant. Many ways by itself it does, but also it does support the glutathione, a lot of enzymes in glutathione. So it controls a lot of enzymes with glutathione. So it also has a double benefit there.
And it's for the detoxification, and it protects the cells within the body.
Yes.
So, and you mentioned before the broccoli sprouts are a great way to improve NRF2 pathway.
Yeah, I have all my patients on it mainly because when I do genetic testing on them, another test that I really like to do, I do nutrigenomic testing. 93% of my patients have NRF2 polymorphism, which AKA called mutation. I hate that word mutation because people think it's like a disease, but it's not. It's just a variation of the normal type, the wild type. So 93% have this polymorphism. 67% have an upregulation in something called KEAP1 that slows down the NRF2. So you need even more support of your NRF2 if you have a KEAP1 upregulation.
I remember Dr. Perlmutter used to have a supplement that he used to recommend for that pathway. But anyway, let's go to oxalates as we're finishing up. What are the symptoms of high oxalates in the body, and how can we get rid of them?
Oh, there's so many. We've got kidney stones, or what most people know about them as, right? So if you go to look at a doctor, they'll say, oh, you have kidney stones, but there's a lot more. There's breast cancer, pulmonary fibrosis, pain anywhere in the body, joint pain, arthritis, bladder pain, interstitial cystitis, painful bowel movements, depression, brain fog. I mean, all plethora of things that can be anything else. They can cause them primarily for 2 reasons. One, they're crystals. They can shred your mitochondria. They can physically shred them, but also they can embed in your soft tissue. That's the problem. And when they do, they can create deposits and they can hurt.
And how can we get rid of the oxalates besides just drinking a lot of water and, and changing, and obviously going on a low oxalate diet? And
right. Binding with minerals is a really good way to do that. So if you're low in minerals, that could be another reason why you're absorbing them easier. Also, fixing your gut health helps you absorb less in your diet, going on a low oxalate diet, obviously. But the big one a lot of people don't know about, mold overgrowth is a source of oxalates because it's part of their microbiome. So you've got to make sure you address that with the dysbiosis piece of it. And also, oxidative stress can cause your body to upregulate the production of oxalates. So you got to get the oxidative stress down using your antioxidants.
You talked about mold. A lot of people have mold overgrowth. Richie Shoemaker was the original person that used to talk a lot about it. How does that relate to oxalates?
It's part of their microbiome. So Aspergillus and I think the other species, Penicillium, particularly have oxalates as part of their microbiome. So if you actually have overgrowth of these microbes in your GI tract, well, you're going to have more oxalates in there as well. So obviously it has a potential to become systemic.
So I want to thank Dr. Mandy LaGreca for joining me today. She's a wealth of information, as you could tell. She's given us a lot of really great tips. Go to her website, IC Healer, to learn more. But if they want to learn more about you, Mandy, and they want to look at your Facebook, how can they do that?
Absolutely. So I have a lot. I'm very active on social media. Dr. Mandy DCN is my handle for Instagram. I'm very active on Instagram. And I'm also active on TikTok. They're both the same handle, Dr. Mandy DCN. I am also on YouTube, IC Healer. I do a lot of educational, and I do my own podcast there as well. I have my own podcast as well too. Oh, you can get that off of my Instagram. I have a link to my podcast. And finally, on Facebook, I have a private Facebook group. It's IC Interstitial Cystitis. Obviously, you have to be approved to come in. So there are some questions that I'm going to ask you before you can come in, because it is a private group. And I think that's pretty much my social media. Yeah.
I want to thank Dr. Mandy. Thank you for joining me today. This is Dr. Kerry Gell for Open Your Eyes Radio on AM 1280, The Patriot.
Your eyes and your vision are under attack. Damaging blue light from the sun, your phone, your computer, your tablet, even light bulbs and car headlights is constantly bombarding you. The good news is our eyes actually already have a line of defense to counter the effects of blue light. This defense is made up of 3 pigments called carotenoids. MacuHealth with Micromicelle, the only supplement with the exclusive patent on all 3 macular carotenoids and Micromicelle technology.
Fitting multifocal contact lenses presents a big opportunity to meet patient needs while growing your practice. Alcon is your partner not only with our innovative portfolio, but through e-learning. Learn to enhance your multifocal strategy today with the Alcon Experience Academy.
OIE Broadcasting is the emerging leader in social media. We use scientific entertainment to drive more patients into your office. Visit oiebroadcasting.com and sign up today.